everyone. Welcome to another Mindful Injury Recovery interview. I have to say that I got numerous requests in the past to do this type of interview. You guys are really interested in the topic about intimacy and especially about sex. How to have sex after an injury, after an accident. So today we're going to be talking exactly about that. And I invited John Bio, who is a physical therapist, and he received his doctorate of physical therapy in 2006 and now resides in Long Island, New York. He has dedicated his career to the physical, mental, and social recovery of his patients throughout their rehabilitation journey. And his recent specialization involves educated clients on how to stop avoiding activities, but instead take the right steps to get back to them. So, John, thank you so much for joining me.
Oh, thank you for having me, Maya. Appreciate it.
So, I'm always really interested about the stories behind the why someone decided to do something. So, can you share with us why did you decide to become a physical therapist?
Yes, it started when I was very young. I was actually about 14 years old, and I used to watch the trainers and the medical professional run onto the field when I was watching sports events, whether it was hockey or football. I loved watching the trainers go on and help the players get back into the game. And that kind of inspired me to become a physical therapist. Once I found out that I would have to travel a ton, I didn't want to do the team training. I went back into learning about physical therapy for a clinic or like an outpatient setting. The outpatient setting was great that I first started in. It was sports-based, and I really appreciated getting athletes back to their game. That, to me, was the ultimate goal. Here's a player, he's injured, fracture, get him back to the game. But throughout the years, I've seen that there's much more to get back to than just sports, whether it's taking care of your grandchildren or grocery shopping. These things are just as important, and I've become very interested in getting patients back to those things as well, not just sports. As a lot of physical therapists start, but I got really interested in the overall recovery of any activity for the day, including daily things, shopping, taking care of kids, recreational things like sports, and of course, intimacy always comes up as a daily activity, hopefully daily activity.
Yes. So do you get a lot of questions about intimacy and about sex from injured people?
No, it's unfortunately not as often enough. And some patients will kind of hint at it and not be very direct with their questioning. Maybe it's a male-female thing. Maybe it's a professional versus a client thing. But I don't get enough questions about it. I get more than most physical therapists do because I do sometimes ask about it. I ask what activities are difficult. Tell me everything. And I really get into their personal life as much as possible, as much as they're willing to share. I mean, as a professional, I try to be very respectful of their boundaries too. So if someone's kind of hinting at it and I can tell they're going in that direction, I will bring it up. And more often than not, when a patient brings it up, I think it's a great opportunity to just dive right in and take care of everything that can be covered right then and there. And so I get maybe asked twice, 3 times a week about it, which I think is more than most physical therapists who get asked. But sometimes I even think that another client might hear me discussing it with another client and bring it up. And they'll bring it up. Yeah. Oh, I have a question too about something like that. And all our conversations are private with clients, but there's always that last little question like, oh, I had one more issue I wanted to ask you about. And someone will ask me in the waiting room. And then someone else will chime in and ask about it too. So I think once the door is open, it's much easier to walk into that door. And I was kind of happy to do this interview to kind of hopefully open up that door for some of your faithful followers to bring up to their healthcare providers.
Yes, absolutely. And, I think that we are all really interested in the topic, but sometimes it's just a bit harder to bring up this. And especially, when you are in this kind of difficult situation and you are, you have a fracture or a sprain or whatever, and it's like, well, I have to take care of that, but still I have a partner or I want to be active. So do you think that it is important or necessary to talk about sex and intimacy with a physical therapist?
Yes, it's number one, very, very an important thing. Let's just say that. Number one, it's important to talk about. But there's always a caveat, is if you're comfortable talking about it. It's not something that I will force and discuss with everyone. I give out a questionnaire, a disability questionnaire, with some basic activities for life. And number 21 is sexual activities. I know that every time, for some patients, we'll just leave it blank. And if a patient leaves that question blank, I know right away that they just don't want to answer that question. If someone puts no difficulty and they circle the no difficulty option, I know that it's not something I need to touch on them. There's 5 choices across the bottom of that answer. And if they pick extremely difficult or unable to perform, then I might begin the topic with them and see how comfortable they are and bring it up. So if your doctor, your physical therapist, or anyone gives you that questionnaire and you want to know more about it, make sure you answer that question honestly. Don't be shy to say, oh, everything's fine, and then kind of glaze over it. Make sure you ask about it if you do feel comfortable asking about it.
Yeah. Oh, I love that you have this questionnaire, because when I was working with a physical therapist, I don't recall that there would be a question about intimacy, about sex. So I love that you already have there, because sometimes, like you said, it's a bit more, not awkward, but for some people maybe a bit awkward situation. So if they already have like a way to start talking about this, I love that you have that. But
number 21, question number 21.
Yes. But what about, for example, that people get questionnaire like I did, and there is no sexual activity? Should they just maybe write like, so I want to talk about that as well? Or what do you suggest how the patient could go into that?
Well, a very basic physical therapy examination will incorporate range of motion, strength testing, but the best physical therapy evaluation will incorporate functional activities that are lost. And although walking and stair climbing and running and things like that will be discussed 99% of the time, as soon as that physical therapist or the doctor asks you about what functional activities are still difficult for you to do after your injury, or what you anticipate being a difficult thing after this injury, that is your time to bring it up if you feel comfortable. And I want patients to feel empowered to bring something like that up to their healthcare provider. 99% of the time, you will not shock your healthcare provider. These are people that have gone through years and years of school, anatomy, they're adults as well. They won't have a problem answering the question. If you do notice that your healthcare provider is shy or not comfortable with answering the question, they turn bright red or they stutter a little extra, then maybe time to consult with a different healthcare provider just for that one topic. Sex therapists do specialize in all sorts of recovery, but they could also maybe coach you through an intimacy issue. And that might be the time for me, if I don't feel comfortable, to refer out to a sex therapist or speak on behalf of myself. Because I do feel like for an injury, I am the expert to help someone get back to doing what they need to do. Maybe not psychologically, there's psychologists, psychiatrists, sex therapists that would help them psychologically get back to it. But if there's a physical limitation, I want to be the person that they speak to.
Yeah.
Intimacy or grocery shopping.
Yeah, absolutely. And this is such a good point, because you have all that knowledge about anatomy and what is actually happening with the client physically, so you can actually help them maybe in a way better than sexual therapists, because sexual therapists, like you said, yes, psychologically, emotionally great, but you are there for physical, which with serious injuries is a big problem. It's a big challenge. I hear a lot of time, women, for example, with, cast on their legs, like, so what should I then do, or how to do it? Or, we want to do that, but it's just really weird. Yeah. So yeah, I love that. So how much time after an accident, after an injury, should a person wait until they become active again? Because, it's like, for me, I'm really also interested in that, because, it's like, so rest versus and healing versus, endorphins and being really intimate and connected. So is there a certain time limitation, or, how long should they wait?
I'm glad you brought up the endorphins part of it. That is a very important part of recovery. And if intimacy can bring you endorphins and you're feeling better, that's a great supplement to any physical therapy or medication or activity that you're doing after an injury. As far as time frames, I unfortunately can't give you a set answer. It would highly depend on the injury itself. For example, if you have a fracture, let's say an ankle fracture, depending on the weight-bearing status, if it's in a boot, an immobilizer, if it's just a bad sprain, or a lumbar surgery, each injury will have its own timeline. The most common question I get is about intimacy following a hip replacement surgery. Because after hip replacement surgery, there are certain restrictions that you cannot do. You can't bring your leg up to a certain angle, you can't cross your legs over or turn them in, and that ends up becoming an issue for intimacy. So that is probably the most common injury I hear the question about. And for them, I tell them it's very limited, very restricted based on those protocol restrictions. To give an example, if you can't pick your leg up, then any position involving you having your leg up is off limits until the physician clears you to say, okay, you don't have to worry about those restrictions anymore. So, and that's the time when I get to be creative with the patient and have them be creative with their partner and see what they can or can't do. My job is to educate on what you can and can't do. They kind of take the creative reins out and figure out what is okay and what is not okay.
Yeah, so you are not actually talking then about different possibilities with Kama Sutra with them. You just leave them to explore that.
Yes, I say don't put your leg here, there, or there, and don't turn your body here, or there. Same as if there's a lumbar surgery and they're not allowed to twist or bend. I'll say these are what you're not allowed to do, including in the bedroom and including when you're intimate with your partner, and have them kind of go that route and figure out what they can and can't do. If they need suggestions, I'm more than happy to give suggestions. But I start with the basics and then kind of see how the conversation goes.
Yeah, awesome. So, talking right now what you just described, and if we have like a really serious injury, it doesn't matter if it's ankle or hip or back or whatever. So is it like normal to think about that the partner who is uninjured, that will do the majority of the work, so that the injured person is more or less just like, okay, and then, the partner does the majority of the work?
Yeah, well, I always start the conversation with patients saying that there's a preparatory phase before you go back into intimacy. And that only involves the injured person. The injured person themselves will take the time to figure out what they can and can't do. They'll talk to their physician, they'll talk to their physical therapist, and then they'll figure out the movements that are restricted, the ones that are completely off limits. Then, by themselves, I advise them to lay down or stand up or get into a comfortable position and start to see what movements you can or cannot do that might be needed to be intimate. Lay on your back, move your hips to the side, see what kind of movements are okay, and let yourself slowly explore them. Then it gets into the next phase of starting to be a little bit more active. Quickly twisting, quickly moving your legs, quickly turning, and seeing if that's okay. There's definitely an element, or benefit, I should say, of self-pleasuring before you get into intimate with your partner, because you'll know kind of what to expect as you do go through those quicker movements, and you will feel comfortable knowing that at least by yourself, you were okay. And then you'll kind of take all that and bring it up to your partner. So now this is where the partner comes in. The communication between what you've discovered after your injury and your partner is huge. You'll let them know movements that are comfortable, movements that are uncomfortable. For example, if I lift up my hips and shift them to the side, that hurts my back a lot. Or I can't lift up my hips because I can't put weight into my right leg because of my ankle fracture. So moving my hips, using my legs is not a possibility. And then after that conversation is had with a partner, you can kind of figure out what's left. What can you do? And that's when it's important to talk about your expectations. Certain things are not going to be possible after an injury. If you are into acrobatics and that's what you're into, it might not be possible after an injury. And you have to have realistic expectations. Both partners involved have to have realistic expectations.
But I think, now that you were explaining a bit more, if you cannot lift your hips or whatever, I think that this can be also a really good time for the partners to explore something that maybe they didn't explore before. So it can be even more connecting experience, because you're actually maybe exploring new ways of pleasure.
Right, changing the definition of intimacy.
Yes.
And when someone's been married for a long time, for example, they might have gotten to a routine of this is how we do it in this position on Tuesday night at 8 o'clock, and that might be fine for them, but after an injury, it might have to change. when they first started their relationship, let's say when they were first dating, intimacy wasn't Tuesday night at 8 o'clock. It might have just been at a movie and you put your arm around the person and you start touching a little bit, or you kiss in the kitchen, and then it gets to evolve a little bit more like that. So maybe it's important to kind of go back to that intimacy you had when you were first dating before you actually have an intercourse. Maybe talk about, touching and feeling and kissing, all that stuff, and get back to that as your first level of intimacy again. Almost like you're kind of working your way back up from how you started the intimacy, and go nice and slow like that.
Oh, I love this, that you're talking about, just imagine that you are at the beginning of your relationship, right, and then you are going into, and exploring. I think, well, from a woman perspective, it's like, it sounds like really exciting. It's like, oh, it's like having like a new relationship, new type of relationship.
Right. And you kind of you cross those boundaries slowly as you feel comfortable, First it's just a kissing, then it's a little bit more touching, The rest of you guys know that. You guys know the rest. But early on in a relationship, you just don't go right to intercourse the first day, the first minute you meet. You kind of slowly work that intimacy up the entire time until you're ready to have intercourse. So it's important to kind of rekindle that same kind of thought process and see what's comfortable and what's not for both parties.
Awesome. So why can intimacy or, sex, in that matter, be an issue after an injury, after an accident?
There's several things that would make it an injury. Obviously, I focus on the physical limitations of it. You literally can't move here or there. And most of the time, pain is what limits it. It hurts when I do this. It hurts when I do that. So I can't do this. So I can't do that. That is very frustrating. And it's frustrating to find that out while you're being intimate. You want to know that before. This way it doesn't kill the mood, for lack of better words. You want to know going into it to keep things going while the intimacy is happening. But some other possibilities of things that might limit intimacy after, or some issues that might come up, are scars. If you have a scar and you're self-conscious about it, or self-image issues because maybe you're not in the same shape you were before your injury, or just at the same fitness level, or you get tired quicker, that is very limiting mentally to either partner. Also, certain medications might change your libido, might result in dryness or inability to get aroused. If those medications are present, then that would be a very big issue into getting into it, more so than I could help the person with, just physically. The medications are limiting that. Maybe it's time to have a conversation with the doctor who prescribed it and see if you could wean off of them, stop them, or modify them.
Yeah. And I think that, this time then is the perfect time for the partners to really start communicating. So it can be a step forward in their relationship, because right now, everything that you are explaining is like, do the talk first and then do the action. It's not like,
and then execute.
Yes, exactly. It's not like, oh, let's do this right now in this moment, and we actually have no idea what is going to be happening with my body or with the body of my partner.
And you could potentially risk re-injury too. That is a possibility. So it's important to kind of work your way through it and then find out what you can and can't do. But that's back in that exploratory phase when the injured person is by themselves figuring out their movements as best as possible. If you have a great partner, you could do that exploratory phase with them. And they might be okay with you exploring and seeing how you can move. But for the most part, you could practice that on your own and then give the findings to your partner.
Yes. Well, what you just mentioned right now, that potentially you can re-injure yourself. There is, I work with people, and especially with women, and there is a lot of, fear of re-injury. So what do you then suggest about that? So is it just follow your body and listen to your body, or what to do in regards to that?
Because of the restrictions that you might have after a surgery or an injury, that is number one priority, to maintain all those. If you're non-weight bearing, put weight into your affected limb. Do not put weight into that affected limb. It's not a guideline or a recommendation. It's a hard restriction that you have to follow. So it's not just a suggestion. Make sure you follow that, and then go from there. Everything else that you might want to try could be okay. It could be a re-injury. For example, that hip replacement that I was telling you about before. There's certain restrictions that you cannot do. The reason the restrictions are there is to prevent a dislocation of the hip that they just replaced. And a hip dislocation is not a fun process that anyone wants to go through. That would end the intimacy right there, you know? So it's important to follow those restrictions to prevent the re-injury. And as long as you're following them, things should be good.
Yeah. So my question here is, because it happened to me when I was still in the moon boot, and you know, it's that slip, that fall, that then you are all of a sudden you are afraid that what if something happened to my, you know, and I'm not allowed to put any weight. So for example, if in that passionate moment you actually, for example, put weight where you shouldn't be putting it, and it's like a weird sensation, what to do after that? Is this like oh my gosh, we should go to the ER and check that everything is cool, or what to do?
For the most part, you would call your physician first. If you have an orthopedic or a surgeon that dealt with you, you would call their office first, explain what you did. If you don't want to tell them how it happened, you don't have to tell them, but explain to them that you did put weight into your leg and you're non-weight bearing, and they would advise you what to do. They most likely, and in most of the cases that I've seen of patients that end up breaking one of the precautions, the physician always wants to see them immediately. And they'll get you in, they'll squeeze you into their busy day and see you right away just to make sure everything's okay. They might want to re-x-ray it. They might want to look for other signs and symptoms that there's an injury there, such as swelling or redness or pain. They'll do their full examination and then give you the confidence that, no, everything's okay, don't worry about it right now. And then you can go back to your relaxing and enjoying your life.
Yeah, so it's not like...
It is frustrating once you get that, oh no, I just did something wrong, and you start panicking and thinking, am I going to have to start back from the beginning again? It could be very, very frustrating. And the whole part of that preparatory phase, when you're seeing what you can and can't do, is to avoid something like that happening.
Yes, awesome. That's a really good advice, that, you know, really talk to your partner, explore things, you know, before you are actually then executing. And then if something happens, you know, there are always medical professionals that are gonna take care of you. So don't be afraid to explore things. You don't have to wait, right, for, I don't know, for a year or 2 years or something like that.
Definitely don't wait for a year or two. I mean, it's a stress on the relationship that's not necessary. If for some reason your physician told you, maybe after a cardiac incident, told you do not do X, Y, Z for 6 months, a year, then you, of course you'd have to listen to them, and then you would speak to your partner, and your partner would hopefully be very understanding that you physically couldn't do something. But do not add that stress into a relationship if it doesn't need to be there.
Yeah.
And that's kind of why I feel empowered to kind of tell people, go try it, go do what you can, and don't add that stress into the relationship.
Yes, very, very good. So you mentioned a few of the challenges before, but what challenges do injured individuals most often face when it comes to sex or when it comes to intimacy?
You mean besides the
obvious?
Yeah.
Yeah.
Besides not being able to move, it's always choosing positions and activities that can be done. It, like I said before, it breaks the routine of what you've been doing. This works for us, and we've been doing this for X amount of years. It's the hardest part is breaking that routine and figuring out what you can and can't do. And I say to people very informally, change the definition of your intimacy. Almost like how we were talking about that back when you were first dating, intimacy. Touching, kissing, feeling different spots, different areas, different things that you might have done early on and completely forgot that you did that early on, you know. Go back to that stuff first, as opposed to completely just ignoring everything and being very, very frustrated. I think you don't want to cause any extra tension in the relationship. Change your definition of intimacy, find different positions, especially different activities that are still pleasurable, but are not risking an injury.
Mm-hmm. So my question here is, do you know of any book or booklet that would also guide injured people and their partners through this experience? Or is this just like, it doesn't exist, so talk to your physiotherapist or doctor?
If you do not want to speak to your doctor, and you do not want to speak to your physical therapist, and you do not want to message Maya or myself, or if you don't want to talk to anyone about it, there are plenty of resources online. With Google, you could find some information. I know for a fact there's very specific instructions for how to have sex after a hip replacement, for a male and for a female. There's very specific websites and data and even research on intimacy after a spinal cord injury. This stuff exists out there. They have test subjects. They do research on it. It exists. I haven't seen up until now, and I even did a little bit of research to this, I didn't see anything about intimacy after a non-weight-bearing injury. Maybe that's something that we could do some research on. We can compile some subjects and ask them about their experiences, but I haven't seen anything about intimacy with non-weight-bearing. I guess for the ankle fractures, the femur fractures, tibular fractures that are out there that are non-weight-bearing, I would advise them to not so much think about it as do X, Y, or Z, do this, do that, and do that. I would say more so think about what you can and can't do. Like you mentioned already before, where do I put this big cast? Or where do I put this big boot? Leave it to the side and use everything else. Kind of put it there and don't move it around too much. I think would be the best thing. And every partner, I should say, should be very, very understanding about leaving that over there and then not touching it, using it in the act.
Yes. So I love that you brought up partners, because right now we were talking about the injured person, woman or man. But what kind of challenges can their partners expect of injured individuals?
It's the same kind of concept of changing the intimacy. The partner can't have the same expectations they had of their injured partner before the injury happened. They have to, hopefully temporarily, change their expectations. Some injuries do maybe require a longer span of change, but some are just a very short-term change. And if you could just accept that change for a little bit, still have fun, and kind of get past it, I think it'll keep the relationship very, very healthy.
Mm-hmm. So talking about expectations. So what can they actually expect? I mean, you already went through, preparation and kissing and, then slowly, but what is the overall expectation? Is like, okay, so now we're gonna be, 2-3 weeks into more just kissing, and then, or, I mean, I know that you don't have like this is go-to answer and, this will work for everybody. But in regards when it comes to expectations, and if it's also pretty difficult to, explore or know what to expect. You know what I mean?
Yeah, I think more so what you're saying is what else is out there? What can the partner of the injured person do? And there's so many things to do. I mean, without being too specific, I mean, we have hands to use, you have a mouth to use, you have a lot of different activities that can be done very carefully, very strategically, that can still be pleasurable for both partners. So a lot of it is just figuring out, like I said, what you can and can't do. And that's all injury specific, but there's plenty of topics and plenty of different options and plenty of different positions that you can use that are beneficial for both partners. Both partners would be left feeling satisfied, and I think it would keep the relationship very, very healthy.
Yeah. So let's talk about something else right now. Let's talk about Climax, because, you mentioned, I mean, we have medication, and, after some medication, you feel really dizzy and really like off, like just leave me alone. I don't want to be, close to you. But
and that's normal to feel. I want everyone out there who's injured to know that that's not you. That's something else acting on you. That's normal. And your partner should be very understanding of that too.
Yeah. But let's say that we are not talking here about the medication. If we're talking just about the physical injury, so can a physical injury affect libido and also just the feeling of feeling that pleasure, or to experience climax? Is it possible?
Yes, I mean, and the climax and libido question are very, very person specific. Some patients injured, their leg is in 10 out of 10 pain, they're still able to have sex, so that their libido is great and they're climaxing the exact same way they were before. Some patients with the slightest bit of apprehension and no pain at all might have difficulty. If they're constantly thinking about that foot in the boot and hope they don't injure it, hope I don't injure this, hope I don't injure this the entire time, definitely going to affect their libido. And especially in women, it may affect their ability to climax. I don't know if you have any input as a female about maybe libido or climax as an injured person. I know you were injured too, so that might be a better question for you to answer. as far
Yeah,
as, yeah.
well, it's definitely, I mean, I'm a type of person, a type of woman who, when I'm really under stress, it's like I don't feel, to be really intimate because, I mean, my mind is completely overwhelmed with that.
Right. So now think about if you were out of work because of your injury, you're not doing the recreational activities like going to the gym that you were doing to. That's just now added more stress. It could be financial stress, and that all adds to it. So that's exactly kind of the answer I was expecting from you, that it could be a
Yeah.
lot of stress and you wouldn't be able to.
Yeah, definitely, definitely. And, I mean, my story is also completely different. I mean, when I was recovering from that fractured ankle, I was going emotionally through like a storm with my partner, with my husband, because I was sexually abused as a little girl. So, for me, it was everything. It was this injury and going
Wow.
deep emotionally. So, I mean, our sex life back then, it was definitely not normal, whatever that normal means,
Right.
So what I would advise from a female perspective is that be really gentle with yourself and also forgiving, and take also the time, if it's needed, to heal some of the wounds, because I believe that accidents happen for a reason. For me, that was one of the things that I really had to deal with. And
Wow.
it can be, like you said, with the communication and, taking the relationship to another level, this can actually be a great time for partners to connect. Or, if something is really, if it wasn't working before in the relationship, maybe it's also the time, sadly to say, to end the relationship. So that's my 2 cents.
Yeah, I applaud you for coming out and talking about how you had that in your past and you kind of had to deal with that, deal with it again, and when you were injured. That's I applaud you for coming out and talking about that. That's very open of you, and hopefully very inspiring for a lot of others to deal with it. But I do love how you touched on that rekindling, how that could happen in your relationship. So out of an injury could come a better relationship, a better, stronger relationship. Here's new activities in the bedroom that we're trying now that we never used to do, and we found out we actually like them. That's kind of fun. We'll add this into the rotation.
Yeah, exactly. And then maybe in a few years, you can have conversation like, do you remember when you were in a cast? That was really good position. So let's try that.
Right. Exactly. I think that would be the best outcome out of all of this, is if you can have a better relationship after an injury. That would make my day if someone told me that. That would mean that they really took their injury and conquered it.
Yes. Yes. So what is your number one advice for an injured person and their partners when it comes to intimacy and communication, for example?
Take the time to go through all the steps. You already mentioned once, don't rush right into it. Do not come home from the doctor or the hospital that first day and try to pick up where you left off. Take the time, whether it's days or weeks, to figure out what you can and can't do and communicate what you can and can't do, and then execute. Make sure that prep work is there. That's easily the number one thing, because without that prep work, injuries can happen. Bad communication while the intimacy is going on could happen, and that could completely turn someone off for any future activities. And you don't want to do that. So take your time. Number one, take the time to do the prep work before, and then hopefully it pays off in the end.
Yeah. Oh, John, I so love this conversation. I mean,
I know
that it's so extremely important, because I don't think that we talk enough about this stuff. And these are like really primarily things. I mean, we all have some sort of intimacy, whether just with ourselves or with our partners or whatever. So I think that this is so important. And, going back to endorphins, I mean,
Yeah.
you can actually help yourself and your body if you have enough endorphins flowing around, in your body.
Agreed. And that endorphin release is great for an injury. However, by whatever means you can get it. And if it also helps your relationship out at the same time, it's a double bonus.
Yes. Oh, John, thank you so much for joining me.
No problem. Thank you for having me. I loved it.
Yeah, so questions, if anyone has any kind of question, post it down below, and maybe we can explore some more things in the future, if there will be, of course, enough like raised hands, like, yes, let's talk about more about that.
Yeah,
I know that I really enjoyed it.
Sorry, and if we notice a common thing that comes up more and more, maybe, for example, non-weight-bearing injuries or hips or spinal surgeries, if we notice a common thread, maybe we could do a very specific lecture or advice on just that one type of injury. Maybe that could be something we could do in the future.
Oh, I love that. That's a great
A
idea.
little bit more specific answers. I'm sorry, some of the answers are kind of general, but I was trying to touch everyone's base, you know?
Yes, and I think that this is like a great first step. It's like a prep step, like, you know, in intimacy, we prep now, and then we can go into more details about specific injuries. So, John, thank you so much for joining me.
No problem. Thank you for having me.